Nikki Hoover, in case any of you don't know me. I'm a hand therapist. So I do work with people after shoulder surgery, generally total shoulder replacements or reverse total shoulders, rotator cuff repair rather, and some other various shoulder surgeries. So I'll talk to you a little bit about what I think about before I even go into a shoulder eval, and then maybe some considerations that mostly involve precautions after surgery. So the first thing is I definitely think everyone should read and get used to the terminology in an operative report. So if you get the opportunity to access an op note, it's a really great way to sort of really think about which structures were affected in the joint or around the joint and what you might want to be careful of when you're first going into it. So for example, probably one of the most common structures that is involved when a surgeon goes into an open approach for the shoulder, they're going into what we call the deltopectoral groove, which is sort of right in the sort of anterior lateral part of the shoulder where there's not a lot of muscle coverage. So between the deltoid coming down this way and the pec coming in this way, they're finding that little groove. When they go in there, then if the surgery involves going down to the joint, generally speaking, so for a shoulder replacement, the surgeon has to actually cut the subscap muscle, which comes from behind or I guess anterior on the shoulder blade to the front of the humerus and attaches there. So when they actually cut that muscle, one of the considerations right away is no external rotation beyond a certain degree based on how tight the repair was, which can also be related to how healthy the tissue was in that joint or on that muscle. Okay, so if I think about that when I'm going into this to work with this patient, I'm not going to evaluate their external rotation beyond that degree that I'm allowed to do, which should be listed in the op note. If not, I might want to contact my doctor to say, how far do you expect this person to be able to go right after surgery without damaging the repair? So again, muscle is here, so we call this, after a surgery like that, we have this safety zone, which involves basically elbow extension, elbow flexion, and external rotation to basically neutral. So anything beyond this sort of box where that happens is considered your safe zone, and if you go outside of that, then you've done something that might actually damage the shoulder again. So that safe zone is either 0 degrees or 30 degrees, and that is one of the first things that I'll do to make sure I'm not gonna hurt the person at the eval.